It's 7 a.m. You've barely opened your eyes, and already you're exhausted. Not just tired, but that deep, heavy kind of fatigue that doesn't go away with sleep. You shuffle to the kitchen, test your blood sugar, and once again, the numbers glare back at you, higher than you'd hoped. You did everything right yesterday. You avoided sweets, took your meds, even skipped dessert, and still, your body refuses to cooperate. If you've been living with diabetes, you know this feeling too well. The frustration, the fear, the constant guessing game of what your body will do next. And maybe the worst part is, this despite doing everything you're told, it's still not enough. You've got your prescriptions, you try to eat better, but your energy crashes by noon, your hands feel numb, your vision blurs when you're stressed, and you wonder, is this just how it's going to be now? But here's the part no one told you. Sometimes, what your body truly needs isn't another medication. It's a missing piece, a simple nutrient your body can't function without, yet no one ever checked for it. Today, we're uncovering 7 essential vitamins that can quietly and powerfully help your body balance blood sugar, reduce complications, and restore that energy you've been missing. Let's start with the one that most diabetics are silently lacking, and they don't even know it. If there's one nutrient that quietly affects nearly every cell in your body, it's vitamin D. And for people with diabetes, its role is even more powerful than most realize. Vitamin D isn't just about bones or sunshine. It acts more like a hormone, helping regulate insulin sensitivity, inflammation, and even mood. Low vitamin D levels have been linked to insulin resistance, which means your body struggles to use the insulin it produces. That can leave glucose floating around in your bloodstream instead of being used for energy. Over time, this contributes to those frustrating blood sugar spikes you see, even when your diet hasn't changed. Many people with diabetes are deficient in vitamin D without knowing it, especially if they live in places with little sun, have darker skin, or spend most of their time indoors. And the symptoms of low vitamin D, such as fatigue, depression, and slow healing, can easily be mistaken as just part of having diabetes. But the truth is, they may be signs your body is crying out for this crucial nutrient. Studies have shown that improving vitamin D levels can help lower fasting blood sugar and A1C levels. Some people even report having fewer cravings, more stable energy, and clearer thinking when their vitamin D is in a healthy range. In addition to improving blood sugar control, vitamin D also supports immune function and reduces inflammation, 2 major issues people with diabetes often face. Chronic inflammation has been linked to a wide range of complications, including heart disease, kidney damage, and nerve pain. Vitamin D can help reduce this silent stress on your body and make it easier to heal and recover. You can get vitamin D from fatty fish like salmon, sardines, or mackerel, as well as fortified foods like dairy products and cereals. And, of course, sunlight is a natural source too. Just 15 to 30 minutes a day can help your skin produce it naturally. But for many diabetics, especially older adults, or those with limited sun exposure, a supplement might be the most reliable way to restore optimal levels. Just remember to get your levels tested, because too little is dangerous, but too much can also cause harm. Now that vitamin D has helped build the foundation for better blood sugar control, it's time to look at another silent nutrient hero, one that works deep inside your cells to support insulin function and calm inflammation. Let's move on to magnesium. If you've ever felt drained, anxious, or dealt with muscle cramps that seem to come out of nowhere, you might be missing one of the most underrated minerals for blood sugar control. For people with diabetes, magnesium isn't optional, it's essential. Magnesium plays a central role in over 300 biochemical reactions in your body. But its impact on blood sugar is especially critical. It helps insulin move glucose into your cells, where it's used for energy. When magnesium is low, this process breaks down. The result is higher blood sugar, more insulin resistance, and increased fatigue. What's more troubling is that nearly half of people with type 2 diabetes are magnesium deficient. And it's not just because of diet. High blood sugar causes your kidneys to flush out magnesium, meaning the more out of balance your sugar is, the more magnesium you lose. It becomes a vicious cycle. Low magnesium raises blood sugar, and high blood sugar lowers magnesium even more. Signs of deficiency are often subtle. Restless sleep, tingling hands or feet, irregular heartbeat, and even mood swings. You may find it harder to fall asleep or stay asleep, or wake up feeling like you haven't rested at all. Some people report frequent headaches or feelings of depression they can't quite explain. But replenishing your magnesium can make a noticeable difference. Studies show that proper magnesium intake can help reduce fasting blood sugar, improve insulin sensitivity, and lower inflammation. Magnesium also supports the relaxation of blood vessels, which can help lower blood pressure, a common problem for people with diabetes. And because it plays a role in nerve function, it may help ease the symptoms of neuropathy as well. You can find magnesium in foods like spinach, almonds, pumpkin seeds, black beans, and avocado. But depending on your current levels, a high-quality supplement may be necessary to restore balance. Magnesium glycinate or citrate are often better tolerated than magnesium oxide, which can cause digestive upset. Just be sure to talk with your doctor first, especially if you have kidney issues or take diuretics. While magnesium helps insulin work more efficiently, there's another B vitamin that works like fuel for your nerves and your metabolism. And if you've ever struggled with tingling feet or burning pain, this next one could change everything. Let's talk about vitamin bone. If you've ever felt a strange burning, tingling, or numbness in your feet or hands, it's not just uncomfortable, it's a warning sign. For many people with diabetes, those sensations mark the beginning of nerve damage known as diabetic neuropathy. And one of the most overlooked defenders against this is vitamin B1, also known as thiamine. Thiamine is vital for nerve, health, and energy metabolism. It helps your cells convert glucose into usable energy, and, more importantly, it acts as a shield for your nervous system. But here's the problem. People with diabetes often have lower levels of thiamine, and this deficiency can quietly accelerate nerve damage. Research shows that high blood sugar can actually reduce the amount of thiamine circulating in your body. The more sugar in your system, the more thiamine you use up. And as your levels drop, your nerves begin to suffer. That tingling, that burning, that strange walking on pins feeling are signs your nerves are under attack. Without enough thiamine, the nerves in your feet and hands may become more sensitive, making ordinary sensations feel painful or uncomfortable. It can also affect balance and coordination, which increases the risk of falls. Over time, if left unchecked, nerve damage can become permanent. That's why early intervention matters so much. There's also a special form of thiamine called benfotiamine. It's a fat-soluble version that your body absorbs more easily than regular thiamine. Some studies suggest it may even help reverse some symptoms of neuropathy when taken consistently, especially in the early stages. In countries like Germany, benfotiamine has been used for years to manage diabetic nerve pain with promising results. You can find thiamine in foods like sunflower seeds, black beans, lentils, pork, and whole grains. But for those already showing signs of nerve damage, a supplement may offer better support. Always talk to your doctor before starting, especially if you're on multiple medications or have other conditions to consider. If vitamin B1 protects your nerves from the damage that diabetes can bring, the next vitamin helps protect your brain and body from something just as dangerous, which is silent deficiencies caused by medication. Let's move to vitamin B12. You take your medication, eat the right foods, and try to stay active. But something still feels off. Maybe it's the nagging numbness in your hands, the pins and needles in your feet, or that strange sense of mental fog that makes it hard to concentrate. If any of that sounds familiar, your body may be trying to tell you it's low in vitamin B12. Vitamin B12 is essential for nerve function and brain health. It helps produce red blood cells, protects the coating around your nerves, and supports cognitive clarity. And yet, many people with diabetes are unknowingly deficient in it, especially those taking metformin, one of the most common diabetes medications. Metformin, while effective, can slowly reduce your body's ability to absorb B12 over time. This means that even if your diet includes meat, eggs, or dairy, all good sources of B12, you could still be running low, and the symptoms don't show up all at once. They creep in slowly. A little fatigue here, a little memory slip there, a weird tingling sensation that you brush off as nothing, until one day it starts interfering with your life. B12 deficiency is especially dangerous because it mimics other diabetic complications. People often assume their nerve pain or forgetfulness is just part of getting older or having diabetes. But in some cases, it's actually a correctable deficiency. Blood tests can confirm it, and in many cases, B12 supplements or injections can dramatically improve symptoms within weeks. So, while B1 supports your nerves at the cellular level, B12 keeps them healthy and firing properly. But your body's healing isn't just about nerves and brain power. There's another compound that quietly fights inflammation, supports glucose metabolism, and may even improve insulin sensitivity. That compound is alpha-lipoic acid. Some nutrients are like quiet heroes. They don't make headlines, but they do powerful work behind the scenes. Alpha-lipoic acid is one of them. Though it's not as well known as vitamin D or B12, this antioxidant might be one of the most important tools for anyone living with diabetes. Alpha-lipoic acid, often shortened to ALA, is unique because it works in both water and fat environments in the body. That means it can move freely through your cells, neutralizing harmful free radicals and calming inflammation wherever it finds it. For people with diabetes, this is critical. Chronic high blood sugar creates oxidative stress, which quietly damages nerves, blood vessels, and organs over time. ALA helps stop that damage before it goes too far. But its benefits don't stop there. Research has shown that ALA can improve insulin sensitivity, helping your body respond better to the insulin it already produces. It may also help lower fasting blood sugar and reduce symptoms of neuropathy, such as burning, tingling, and numbness in the legs and feet. In some clinical trials, patients taking ALA reported less nerve pain and better circulation after just a few weeks. You can find small amounts of ALA in foods like spinach, broccoli, and organ meats, but the doses used in studies are usually much higher than what diet alone can provide. That's why many people with diabetes choose to take it in supplement form, often under medical guidance. While ALA helps cool down the fire of inflammation and insulin resistance, there's another vitamin that quietly supports your body's ability to handle blood sugar spikes more gently. It's something most people associate with immune health, but it does much more than that for diabetics. It's time to talk about vitamin C. When most people think of vitamin C, they picture oranges, cold remedies, and maybe a glass of juice. But for people living with diabetes, vitamin C has a much deeper role. It's not just about fighting off colds. It's about protecting your blood vessels, reducing inflammation, and even helping to bring blood sugar levels under control. Diabetes creates a constant state of stress inside your body. High blood sugar generates harmful molecules called free radicals, which damage cells and lead to complications like poor circulation, eye problems, and slow wound healing. That's where vitamin C steps in. As a powerful antioxidant, it helps neutralize those free radicals, reducing the stress on your body and giving your cells a chance to recover. Vitamin C also supports the health of your blood vessels. People with diabetes often experience stiffness or narrowing in their arteries, which increases the risk of heart disease and stroke. Studies show that adequate levels of vitamin C may improve blood vessel function, lower blood pressure slightly, and enhance overall circulation. But here's something most people don't realize. Vitamin C can also reduce sorbitol buildup in the body. Sorbitol is a sugar alcohol that accumulates in the nerves, eyes, and kidneys of people with poorly controlled diabetes. Too much sorbitol can contribute to nerve, pain, and damage. Vitamin C may help slow this process. You can get vitamin C from bell peppers, strawberries, kiwi, broccoli, and citrus fruits. But for therapeutic effects, especially if your levels are low, a supplement might help. Just avoid high-dose versions without talking to your doctor, since excess can cause digestive discomfort in some people. Now that we've looked at how vitamin C protects your cells and circulation, let's explore a trace mineral that helps insulin do its job more effectively. It's often forgotten, but it may be the missing key for many diabetics. Let's talk about chromium. You may not hear about it often, but chromium plays a vital role in your body's ability to handle sugar. It's not flashy. It's not talked about on commercials or vitamin bottles. But without it, your cells struggle to respond to insulin, and your blood sugar can stay stubbornly high even when you think you're doing everything right. Chromium works by enhancing the action of insulin. It helps insulin bind more effectively to your cells, so glucose can move out of your bloodstream and into your muscles and tissues where it belongs. When chromium is low, this process doesn't work as well. That can lead to higher blood sugar levels and greater insulin resistance over time. Many people with type 2 diabetes are found to have lower chromium levels, especially if their diet is lacking in whole grains, lean meats, or certain vegetables. And because it's a trace mineral, your body doesn't need much, but it needs enough. Even a small deficiency can quietly make blood sugar harder to control. Several studies suggest that chromium supplementation may help lower fasting blood sugar, improve insulin sensitivity, and even reduce cravings for carbohydrates. While it's not a magic fix, for some people, it's the missing link that helps their other efforts finally start working. You can find chromium in foods like broccoli, eggs, whole wheat, and beef. But the amount you get from diet alone can vary greatly. That's why some people with diabetes choose to take a carefully dosed chromium supplement under medical guidance. Now that we've uncovered all 7 of these powerful nutrients, there's something important to remember. These vitamins and minerals aren't meant to replace your medications or your doctor's advice. They're here to support your body from the inside out, giving you a stronger foundation to manage your health. Let's wrap it all up with a few final thoughts. Living with diabetes can often feel like walking a tightrope. One day your numbers look fine, and the next, they're all over the place. You watch what you eat, take your medications, and still wonder why your body doesn't seem to cooperate. It's frustrating, exhausting, and sometimes even discouraging. But here's the truth that often gets overlooked. Sometimes it's not about doing more. It's about giving your body the missing tools it quietly needs. The 7 vitamins and minerals we've explored today aren't exotic or experimental. They're natural allies your body already understands. From vitamin D to chromium, each one plays a distinct role in how your cells process sugar, protect your nerves, manage inflammation, and support your overall energy. When just one of them is out of balance, your entire system can struggle. But when they work together, they can create a powerful shift in how you feel every single day. Of course, supplements aren't a magic cure. They don't replace your medications or your doctor's advice, but they can be part of a smarter, more complete approach to healing. And when you give your body what it's been missing, you might just find that blood sugar control becomes a little easier, your energy improves, your mind feels clearer, and life starts to feel a little more manageable again. Take a moment to reflect on what your body might be asking for, because sometimes the smallest nutrients can make the biggest difference.